give me a thought, just real quick, how they think sports recovery and chiropractic can be related. How could that even? Let's hear some ideas before we get into it. Anybody? Yeah. Sports. We don't do. You think of sports, right? You think of people taping their ankles or something. Okay. We obviously do something very different than that. But how could it connect? Is that a hand over there? I see somebody. Eddie,
makes you the ability to heal faster. Okay. Proper neurological function.
Very good.
Right.
Yeah.
He's been reading the press.
What about this? Do you have to be an athlete, like in a organized sport, to be able to benefit from like sports recovery, the concept of it? No, because it's your body, it's your physiology. It doesn't matter if it's for a competitive sport or not, right? If your goal is to have a more efficient cardiovascular system, that's important whether you're in sports or not. So this can be applicable to whether you're an athlete or even if you know an athlete, tell them, and this could help them. So just some little stuff there, and then we're going to start with, do you have anything?
No, that's cool. Good.
All right, let's see here. Little video for you.
While most concussion studies are focused on the brain, McMahon's team traces the effects of CTE directly to the upper spine, having found that neck misalignment can block the flow of spinal fluid and pull toxic proteins directly onto the brain.
Spinal fluid is white. That's the spinal cord. This is the spinal column. What you're seeing is a narrowing of the opening where the spinal fluid is supposed to come through.
Most times when you're having head problems, that's all they look at is the head. These guys are smart enough to at least look below the head at the neck and see if there was a problem somewhere, and they found my problem. They're not going to be able to reverse the damage. Like I said, that stuff was sitting in there for 20 years. So how much it ate away at my brain, I don't know.
Using detailed images captured by the MRI scans, McMahon regularly receives targeted adjustments, clearing the blockage and restoring the flow of spinal fluid.
This instrument is going to generate a gentle mechanical tapping that is just lightly going to put those bones right back into normal position. Okay, going to sit back up.
First time they did this procedure, within 2 minutes, it was like the toilet flush. I could feel this stuff actually leaving my brain. My eyes cleared up, my speech cleared up.
The left is before, the right is after. So you see how much there is there? See how there's less than here? Instead of all this white stuff being there, you see more brain tissue than fluid. So it's already started to brain. Over the next several days, it'll improve more.
Cool. So those of you who do not know, this is, I believe his name is Jim McMahon. I'm not like a super big football guy or whatever, but apparently he was like a really well-known NFL quarterback for a very long time. And obviously having a lot of like concussion injuries and things like that in the NFL, he had an upper cervical misalignment that was reducing how much CSF could actually exit his skull. And that was a different upper cervical technique that's a little bit more mechanical, and they do something very similar to what we do. And they obviously were getting fantastic results with him as well with just that. And he's not even competing anymore, but just from the result of, you know, being in sports, it really affected his life. So just kind of show that here. Okay, four things rather that we're gonna go over here real quick is 1, biomechanics, 2, recovery, and then reaction time and hormone performance with everything that's tied in with neurology, but then also with specifically upper cervical chiropractic as well. These are kind of the 4 categories we have here. So number 1, biomechanics. The upper cervical complex determines the biomechanics of the rest of the spine due to the, that's supposed to be DUEs, due to the spinal tract and corticospinal tract. Specifically, the reticulospinal tract also has a major function as well, but kind of showing it grossly here together. This is a plastic model of the spine, of course, back of the head, and then your pelvis right here, and then this is your spine. Now, when this top bone of the spine misaligns, what it does is it actually puts pressure on part of the brain stem that causes the spine to contract. So if you've ever experienced yourself or heard of somebody else having like a back spasming, their spine, the muscles that travel along the sides of the spine actually contract. Now, when they contract, a lot of the time it's because it's irritating the nucleus that controls it to contract. So when this misaligns, it can actually cause your head to go off center, your pelvis can compensate, and your spine can shift as a result. Now, in addition to that, the muscles in the spine can actually contract. So that can throw pretty much your whole spine, quote unquote, out of whack, right? It can compensate quite a bit. So go to the next slide. Looking here, this is kind of how you should be, right? This is your head. This little red thing represents your atlas, the top bone of the spine, your arms, obviously. This is like your pelvis, and then your legs right here. So now go to the next one here. When that top bone in the spine misaligns, what it causes your head to do is go off center. When your head goes off center, it has to balance it back over top center of your pelvis. So when the top bone of your spine goes out of alignment, your head goes off center. Then your pelvis compensates and your spine shifts to bring your head back over top center of your pelvis. This is why a lot of people will say, oh, I've been to a chiropractor before and they told me like my one leg was shorter than the other one. They're not actually, they don't know this, but they're not actually meaning their leg is shorter than the other one. What's happening here oftentimes is the top bone misaligns, head goes off center, pelvis compensates, spine shifts. And then when you put your legs next to each other, the one leg is a little bit shorter than the other one. That's all they're meaning. So a lot of chiropractic offices will actually use that as a pre and a post check to see if it's like straightening out, if you will. But the whole point that we're making about this is the biomechanics of the spine is determined from this top part of the spine. And so that's why a lot of people that come into our office, for example, or people that come into our office, sometimes they come in for maybe just biomechanical issues like, like low back pain or something like that. And it gets resolved just by touching the top part of the spine. It's not magic. It's literally just science. The top part of the spine, when it's out of alignment, causes the head go off center, pelvis compensates, spine shifts. What do you think it's going to do to the nerves and the joints and the low back and muscles in the low back? It's going to cause issues there. Now, actually go back one more. Go back one more before that. Okay. So what's really important is when you're looking at the spine here, if someone is, let's say, a high performance athlete, I like to use Dr. Keys as an example, but if they're a high performance athlete, right? And, he was a big track guy. He didn't you run 100 meters, right?
I did the 100 and I did long jump.
Yep. And then obviously he did track and field in college. And so you have to, when it comes to running, sprinting specifically, whether it's long jump or just sprinting, it's a game of inches, literally a game of inches, or not even inches, but like millimeters at that point, right? And so if you even have biomechanical changes in your spine, like the next slide here, then what happens is, what do you think is going to happen to his like running gait? It's going to be off. It's going to be shifted, and it's going to cause you to not be as dialed in for your running path as it is. Now, when they do like run, like it is literally so important how every little tiny step and movement in the gait is tracked, and this can throw it off. So just one biomechanically, not even talking about from a pain standpoint, but just from like a symmetrical standpoint, it alters a lot. Now you can even go into like bodybuilding, obviously, with people having their spine compensated, or really any sport where just coordination is important.
Or how important is it to get your tires rotated in your car? Pretty important. I don't know why. I'm not a big car mechanic person, but they always said it was important. But I'm assuming because of the wear and tear over time, you got to realign it. So same with your body and your spine. Got to make sure it's aligned.
Okay, so now getting into a little bit more of like just recovery, okay? Now this is very applicable with sports, but not only that, but even just day-to-day life, right? Like obviously, like a lot of times people even say, oh yeah, I'm still not recovered from like the week over the weekend where like I was working real hard, or even just did a lot, was really busy or traveling or whatever. Recovery, very, very important. There's a couple different categories we're gonna go through with recovery, specifically digestion, and then we have some components here. One is GI motility. GI motility just means gastrointestinal motility. So the ability of your GI to basically move it around, okay? So other known as peristalsis or digestion going on in there. Absorption as well. So actually like when you eat food, what do they say? Like you have to eat something that's nutritious, like you eat some grapes or you eat some strawberries, whatever you're eating, and your body actually has to absorb that and take it in. If it's not able to properly absorb it, then it's not going to function properly, which also obviously affects how your brain productivity is, and then also your hydration. In addition to that as well, muscle growth, which is important for recovery as an athlete, but then also just longevity, right? They always say, especially when you're aging, you want to make sure that you have a lot more muscle mass on you. It just helps with the aging process. And then also gluconeogenesis, which is just the creation of basically energy for ATP.
All right, I have a throwback on the biomechanics slide. There is actually a study they've done with apes or monkeys to kind of prove the neurology a little bit more, which we already knew this, that it comes from the brainstem. What they did is they put them asleep with some sort of anesthetic or anesthesia, and they irritated the brainstem, the part that controls the position of your spine and pelvis, and every single one of them, their entire spine and pelvis coiled up very intense, a ton. Obviously a lot more than the irritation from your atlas just naturally, very different, but it also showed and proved the point how upper cervical impacts the rest of your spine, because those tracts, those nerves actually control it. So when they irritated it very intensely, mechanically, directly, it really aggravated it, and that's what we see as well with everybody's spine as well that comes in here on a smaller scale.
Okay, so diving a little bit deeper into, like we talked about with digestion, the GI motility. So really important, your parasympathetic nervous system, that's actually what controls your, they call it rest and digest, okay? So when you eat some food, you always feel like what? Like you're like, oh, I'm like super tired, like I want to go to bed, and I'm relaxed, right? So when your digestion is actually happening, that's because of your parasympathetic nervous system. That's actually what promotes GI motility. So what happens here is if there's interference with this pathway, it can cause you not to properly digest food. That motility actually slows down. So one, bring it back to athletes here. If you're not able to properly digest your food and even move it around in your stomach, you're going to have more bloating. Your metabolism is obviously slowed down, and then enzymatic production is going to change. So what happens is if you're able to actually allow the connection from your brain through your parasympathetic nervous system down to your large, small intestine, even your stomach as well, this is not going to occur. So essentially, you're going to have less bloating, you're going to have a faster metabolism, and enzymatic production is going to be proper. And the importance with the enzymes in your digestion is if you're not producing the appropriate amount of enzymes, then you're not even going to be able to digest food properly in the first place. This goes all the way back up even to the mouth. So there's an enzyme called salivary alpha amylase, which actually breaks down carbs in your mouth. So when you start eating food right away, the saliva starts like breaking it down, the teeth start breaking it down, but then also you produce enzymes in your mouth that breaks down carbs right away. So if the nerve signal that's going to those glands is not proper, then that enzyme production is going to be a lot less, and it's not even going to allow you to digest the food properly in the first place. Really important.
Who loves to make sure they have all their nutrients and take either supplements or make sure they're hitting all their macronutrients, micronutrients, everything, right? That stuff is important, but if your nervous system's not optimized, I think of it like the leaky pool. Who's ever heard of this analogy? It's like you can have a pool and you're trying to fill it up, but there's a hole, and if you don't fix that hole, it's just going to keep emptying and fill it up forever and forever and forever. That's kind of how your body works as well. You can take all the supplements in the world, eat all the proper food in the world, but if there's pressure on the brainstem, which controls your body's ability to maximize those nutrients, like you said, if it's not working properly, then it only does you so good. 80%, your maximum, your ceiling is only so high, and it could be higher if it was maximized.
Okay, so now let's get into a little bit more with absorption of the nutrients. That's kind of what we were just segueing into there. So your small intestine is actually what controls your micro and macronutrients, being able to absorb that. And then your large intestine controls the absorption of water. So number one is when I'm actually eating food, it's going to be my small intestine that's going to be absorbing the nutrients at the higher level. So if the nerve signal that's going to my small intestine is not efficient enough, or sufficient enough rather, then it's not going to absorb it. So you can be getting the proper amount of protein in your diet. You can be getting the proper, well, I guess we could skip to water here in a second, but you could be drinking enough water, but if you're not able to absorb it because the organ is simply not getting the nerve signal, then it's not going to absorb it. It's just going to pass right through, and you're not even going to absorb it in the first place. So the absorption is a whole nother component that a lot of people are missing. And that's exactly what Dr. Case was talking about. How many of you heard like, oh yeah, these supplements aren't good that people take because you're not even able to break it down and absorb it or whatever. Then people will say break down, right? And that's what they actually are talking about, is your body's not absorbing it. Now, that could be true for the supplement itself, but also this goes to even if you just eat normal whole foods. If your body is not able to absorb it properly, then it just won't. Now, obviously, it'll make everything a lot more efficient for absorption of the micro macronutrients. That's going to just make better performance output. For example, if every time I like do activities, let's say I walk, like I'm running, walking, whatever I'm doing, my body actually needs carbohydrates or carbs to use that. So if I'm not even able to properly absorb carbs efficiently, I'm not going to be able to have the proper output. Very important. You're going to say something?
Yes. Oh yeah. A little trivia for everybody here. If you've been to one of our health talks before, we've hammered it pretty hard. We had a whole health talk on just this one nerve. So if you can guess, what nerve do you think is responsible for parasympathetic digestion? We got some hands raised. Do you remember? I think you, yes.
Ooh,
let's go.
Look at you go.
Controls
That's good.
about.
I did my homework.
Let's go.
Wow.
Yes. Yep, vagus nerve. But where does that originate?
Oh, that's a tough one.
That is.
You know that one?
Where does it start? Yes, exactly. The vagus nerve, the great.
That's
wanderer.
true. It is called the wanderer.
Yep.
Yeah, it comes from the brain. Starts at the brainstem. So
But it goes down to
Yeah, 100%. You got it. Yeah,
Controls
absolutely.
About 80% of your parasympathetic, I believe.
Yeah, or it's 80% sensory, and then I believe it is like close to 80% of the parasympathetic nervous system is through there.
Which is all of this.
Absolutely. And then so also you have glycogen storage, which is like your body actually breaks down glycogen in your muscle tissue, or stored in the muscle tissue rather, to use for energy. Also usage of creatine, same thing, that's in your muscles. Sodium potassium pump. So like the usage of your body's metabolism and energy is grossly dependent on how much you're able to actually absorb. It's very important. Now, is that a one-time thing? So what I mean by that is, like, if my body's not absorbing food for, let's say, months, and I'm having issues because of my skin's having issues, I'm having inflammatory issues, and I get that corrected like right now, boom, it's corrected. Now, does that mean the next day, like, everything goes away? Like, no, it doesn't. That means that my body has to actually absorb that food for a long time so that the matter can actually heal as a result. Same thing with performance. You don't just start running one day and then all of a sudden you're in marathon shape, right? That this kind of stuff takes a lot of time, and it's because it's a process. Same thing with the water. Less inflammation, hyaluronic acid toxicity, better overall muscle hydrations. Okay. All right, so going still into digestion here, we got protein synthesis. Here's like a really easy, or not, easy pathway for digestion, specifically muscle protein synthesis here. Hypothalamus stimulates the pituitary gland to release TSH, and then the thyroid produces T3 and T4 hormones, and this actually controls how your body is sensitive to insulin. Now, the organ that produces insulin is called your pancreas, and that's actually what helps you build things. So, for example, to make it simple and easy, if you want to maintain strong, let's say, muscle mass, skeletal muscle mass, you want to maintain strong bones, you need insulin to be produced from your pancreas. And so you need this pathway to be working properly. Now, what's really important is this pathway gets all stimulated, once again, from the brainstem. So your brainstem goes to the hypothalamus, which goes to the pituitary, which is the thyroid, produces T3, T4 hormones, and it controls how sensitive your body is to insulin. Same thing, there's nerves that go down to your pancreas, and that's what's going to control how much insulin is produced. As well, once again, medulla oblongata, vagus nerve, pancreas, insulin, beta cells bind to the skeletal muscle cells, which promote muscle growth. Very important.
All right, just to recap, where on this, I want everybody to tell me yes and no. Where do we think the brainstem is? Okay, I want yes and no's. Like as we're getting closer, hot or cold, everybody tell me, okay? Brainstem. Oh. Okay. Yes, right here. Let's go. Good job. That was great. That's actually what I envisioned in my mind when I picked it up. Is you guys doing that? So that was perfect.
That was good. That was good. Very interactive. That was great.
That is where all of this jargon he just mentioned comes from. All of that whole process comes from. Yes, right there.
Okay, a little zoom in there. There's the arrow. So right here, that's that C1. That's obviously our favorite bone up there, and that protects the brainstem. But also, this purple thing that's highlighted, that is the vagus nerve. So if there's a misalignment at the top bone of the spine, it also can actually put some pressure on that vagus nerve and decreases, for one, function to the pancreas, but also can decrease function to the large intestine, small intestine, all these organs that break down food. That's why you always hear about all this, such a fad right now with like the vagus nerve. Vagus nerve, it's so important that everybody's talking about it. And it is important. However, they're not even talking about, like, this is just like the hose. It's like they're not even talking about the spigot, where it comes from, right? It all comes from right here. And yes, this can put pressure on the hose as well and decrease it, but so important.
Now, there's 3 portions of the brainstem: the midbrain, pons, and medulla oblongata, okay? So the medulla oblongata is the lowermost portion of the brainstem, which is going to be the closest right there by the atlas. And that's where the origin, meaning the starting point of this nerve, is. Right on the medulla of the brainstem. Very cool fact.
Oh, and so tell me something. I mean, all this stuff they're talking about, the vagus nerve and all that, and they've got these, watches that you do and all that. Is that really, is that more than just, I don't know, fluff?
I mean, so there's truth to stimulating the vagus nerve for sure, but the problem is this: does your body know how much it needs to stimulate it? What do you think? You think it knows? You don't think your body knows how much it needs to stimulate it? just in general.
It does, not my brain.
Okay, yeah, right, exactly.
You're asking my brain.
You're 100% right. Your body knows, you're right, but we don't know. Exactly, 100%. So your body knows how much signal needs to go from here through this, okay? If something's obstructing the signal, then that's where we get this idea of, oh, we might as well stimulate this and make this do it more. But what if we just clear up the obstruction of what's causing that to happen, right? That's kind of more our philosophy with it, is actually just correcting it, because I don't know how much it needs at all times. Only your body knows. So it's really important that we actually just fix what's causing it instead of just trying to artificially stimulate it. It's kind of the same thing with like energy in a way, right? Like what do we try to do? Drink coffee to like give yourself energy. It's like your body knows how much energy that it needs at all times if your body is able to produce that properly. So it's kind of like that, but like on a more of like a lesser scale here, because we're talking about the function of the vagus nerve itself.
Now, here's a cool thing when it comes to sports performance, but also just everyday life. How many of the ACE team here, raise your hand. Have you heard somebody be like, I feel like I can breathe better? And that's not what they came in for, but like, I feel like I can breathe better. How does that happen? How does adjusting here help you breathe? Well, let's take a look. The supply, meaning what it does, what it supplies, its function. In here is parasympathetic, very responsible for parasympathetic, meaning rest and digest. And what happens is one of the branches of it, it goes to literally so much in your body. One of them is bronchial. So people who struggle with asthma see amazing improvements. I mean, you can probably even expand on that a little bit more in the history of this, but essentially asthma and their bronchial constriction can be to their lungs, their breathing ability is decreased because there's pressure irritation at the brainstem, which is where this nerve comes from. That's just one pathway and route how it can affect your breathing in your lungs. You might not struggle with asthma, but your cardiovascular system can be inhibited, your breathing can be lowered, so your performance will be hindered, all because there's just a little bit of interference there. So that can be improved. That's just like one little random pathway of how it's connected.
Yeah. Okay, so this is basically the top bone in your spine, but we're looking straight down. So if this is this little model here, this is like the back or like the base of my skull right here, and this is the top bone in my spine. It's like we're looking top down. So we're looking at the top bone right here, straight down. This would represent your brainstem right here, and this would represent the atlas bone here. Each side here, if you go back 2 slides, or go back 1 slide for me, this little like tube thing right here, go up, go back again. That's like this. It's called the carotid sheath on each side. Now this little purple thing is the vagus nerve. So if this top bone rotates, as you can see, go back one more, you can see how close it runs right in front of it right here, and go back again. It can put pressure on it if it rotates. So it can put direct pressure on it as well. Not even to mention that it actually originates on the brainstem as well, and it can interfere with it.
What listing would this be?
Ooh, that's a good question. So this would either be an ASLA or an ASRP, depending on what side it lateralizes to. So if it went to the left, then it would be ASLA. If it went to the right, it'd be ASRP. So you always list it based on what side it's lateralizing to. Good question. Okay, so this is what Dr. Keys was talking about here as well, with that parasympathetic nervous system here. Like we were talking about earlier, even with the liver, or I mean, it doesn't have it in here, but like the pancreas or digestive system as a whole, it stimulates activity when that parasympathetic nervous system is working properly. So once again, brainstem, vagus nerve controls all these things here as well. That's another thing that we didn't even include in this talk, but when there's pressure on that brainstem, it can actually interfere with your pupillary constriction, dilation, and that can throw a lot off as well, especially when you're trying to have quick reaction time.
Yeah, I want to throw in there, I wish I would have done it, but my eyes, when they're doing that, that'd be kind of cool.
Yeah, absolutely. Okay, now getting into a little bit more applicable stuff for recovery, we are going to talk about sleep. So here's just like a random like study we're kind of talking about here with young healthy males that are found that a single week of sleep restriction, less than 60% of normal nightly sleep amounts across a week, reduced circulating testosterone levels by 50%. So your sleep is highly dependent on, your testosterone levels are highly dependent on how much sleep you get. Now, what's interesting as well, here's another thing. Okay, but even more shocking, the only way to rescue testosterone levels to baseline was through restoring nightly sleep amounts with individuals' set points, or what they're kind of supposed to be at. What's really interesting about this is a lot of people will not be discussing many times saying like, oh, I'm trying to get, I am just not going to sleep on time. A lot of times people are like, I'm trying to go to sleep and I'm just not getting good sleep, right? And that's because what controls sleep? Go back one. Your parasympathetic nervous system, your rest and digest. That's what controls all of your sleep-wake cycles that we'll talk
Slows your
about here in a second.
heartbeat. Do you think it's easier or harder to sleep when your heart's racing? Right? It's not trying to sleep. It's trying to wake itself up when that happens. So increase heartbeat or slow heart rate.
Absolutely. You can go next one. Perfect. So here's a little sleep pathway for you guys here. Your hypothalamus, once again, part of the brain cell there, is actually going to the pineal gland, which then releases melatonin. And that's actually what controls your sleep-wake cycle, aka your circadian rhythm. So all sleep, like your cycle for sleep, is all coming from your brainstem. Even though it's a hormonal thing, it's coming from your brainstem. It's very, very important because if there is an interruption with this neurologic pathway, you get poor sleep. So for, once again, to quiz the ACE team, what do we always say to people after their first adjustment, guys? What do we always say? Great. You're probably going to sleep great, right? And oftentimes they come back after their first adjustment and they're like, I slept great. And it's because this pathway has been interfered with a very long time. And once we actually restore that nerve function, they're able to get back into that pathway like it's supposed to be. So in short, less and or lower quality of sleep equals less testosterone production. Testosterone, is that good for athletic performance or bad? Good, right? And obviously it causes more inflammation, decreased function, lactic acid cycle. We go on and on and on as far as recovery goes. Okay, so now here we're gonna talk a little bit more about your reaction time. This is really, really cool for, I think, like just anyone, for example, right? This was a study that was done with upper cervical chiropractic as well. And they actually used athletes and they did what's called research on cortical processing or mental rotation reaction time. I know it's a bunch of crazy words. Basically, if I were to throw something at Dr. Keys, his ability to be able to see it flying through the air and calculate it and realize how fast it's traveling, where it's going, and what I need to do to be able to react to it, that is what they're measuring in this study, okay? Now, what they noticed was after adjustments where they took pressure off of the nervous system and the brainstem specifically, they noticed a 14.9% improvement on their reaction time or their cortical processing time, which meant that these people, and it's really cool the way they did this study, but these meant that these people actually noticed, or not like subjectively, but like objectively, like statistically, they actually noticed an improvement of almost 15% of their reaction time, which is crazy. Now, have you ever felt like, oh, like what I'm doing right now, I just feel like off, I feel slow, like my reaction time is just bad. So this is exactly what it's measuring. It's measuring your ability to be able to react to something, whether it's, you know, I don't even know, like you're walking up something or like you're running or like you're just trying to like make your brain work faster. This was just the movement of an object, which is pretty cool.
And this was just after adjustments. This wasn't after long-term care with improved quality of sleep, which helps your hormone levels balance out over time, which is going to over time help all parts of your health improve, which I'm sure would help your reaction time improve over long periods of time too. So there's other aspects of the healing process that get added up over time that they didn't even have time to necessarily do. So there's levels to the improvement here. I bet it could increase more if they really did studies on like actual clinical care cases.
Exactly. Here's another cool little study here with actual pulmonary function. I think the purpose of this study was actually to help a patient that had like maybe like chronic low back pain or something like that. But they did upper cervical care as their intervention there. And what was really cool was, I haven't read this in a little bit, but it even says here in like some of the conclusion of the studies that chiropractic care is typically considered many as a remedy for neck and back pain. Cases like this one suggest that chiropractic care has a deeper reach into the human anatomy and physiology. A multi-nation survey of chiropractic patients most commonly reported improvement in non-musculoskeletal symptoms like, for example, breathing. Elevated sympathetic nervous system tone has been associated with COPD. One role of the brainstem is to dampen the overactive sympathetic activity, which has been associated with airway smooth muscle tone, or the sympathetic nervous system has a direct connection only to vascular airway, yada, yada, yada. So basically what this is saying in short is that people that have COPD, they have reduced their ability to breathe because it's constricted, right? And it's not functioning properly. It's hyperactive. So what they noticed in this study, which wasn't even for that, but they did research on it anyway after, was that when they got adjusted after and they took pressure off the brainstem, basically the parasympathetic tone was able to tell the lungs to relax and open up because it was hyperactive, which then resulted in them not having as severe of symptoms from COPD, which is pretty crazy, right?
Let's go. All drug-free, surgery-free.
So somebody suffering with COPD, would this entail like a long-term to take care of it, or do you think a couple of, I guess depending upon how severe the COPD is?
Yeah, great question. In general, absolutely, it would depend on probably how, a couple things. One would be, is this what's causing it? That'd be number one. Two would be, if it is causing it, how long has it been like that for? And then three would also just be their body's ability to hold it like that. Yeah, so I would say probably in most cases, people would notice change early, and then to get it to be like permanent, it could vary.
Okay, thank you.
Good question.
Ooh, fun time here. All right, trivia time. You guys know we like trivia, all right? Let's go. Always questions and stories. Here we go. I want to hear, where's Eddie? Where's Eddie? Come on here. I want to see who can guess who this is first. Okay, we're going to put something on the screen. Let's see. Oh, yeah, let's see. You guys ready? I want you guys to all shout it out, okay? Whoever can guess who this is first. Ready? Whoa! I shouldn't have said where's Eddie. He must have cheated. He must have known. So this is, who is he? All right, not Eddie. What is he known for?
Fastest man in the world.
Fastest man in the world. You're all right. Yes, track, running, Olympic, all of those. Yes, Usain Bolt. Not the movie Bolt with the dog, but the Usain Bolt. So fastest man in the world. We're talking about sports performance, but also how fast all of us are in a different way anatomically. So this is really cool, really fascinating. So he ran the 100 meter in 9.58 seconds. We talk about track as a game of millimeters, inches, milliseconds as well. So talking about 14.9% mental rotation reaction time. Let's say baseball, for example, they're pitching 100 mile an hour. It's like a millisecond comes at you. How much more advantageous is it if you can have a 14% improvement in recognizing that? Same with track, 100 meters in 9.58 seconds is so every single millisecond counts. And this is kind of how it all ties into the nervous system. So kind of what I want to do first, I'm gonna play game. I want to see who can do this the fastest, okay? We're gonna test your speed real quick. Eddie cannot win this one. He's gonna stay back there. So everyone, I want everyone to kind of just relax your arm at the side. Pick an arm. Pick your the speediest arm you have.
Whoa.
And basically all we're gonna do is we're just gonna raise it. Okay? You can get a couple practice reps in if you want to warm up your arm. You don't want to pull nothing. But when I say go, we're gonna all as fast as we can raise your hand. You help me look for who was first.
All right.
So I'm gonna say 3, 2,
Wait a
1,
minute.
go.
Where do our hands have to start?
Just that's a good point. Just on your lap.
On your lap. That's good. That's good. Yeah, that's good. That's good. That's
so you can just start with them on your lap. All right, yeah, you guys can start at the shoulders here. All right. So it's gonna be 3, 2, 1, go. You ready? 3, 2, 1, go. Whoa! I think people jumped the gun there.
That was
disqualified. Some disqualification.
There was.
What's interesting about that, what you just did, there's so much that went on behind the scenes to get your arm to be able to do that so fast, and we're going to talk about it. So let's assume about 1 meter from your brain to your hand, okay? Then 1 meter to send sensory feedback back to your brain, because things have to go out, but things also have to come back to your brain, okay? It's not just a one-way road or street. A nerve signal, on average, anywhere from 50 to 70 meters a second, okay? 1 second, 50, 60 meters. You do some math here real quick. I'm really good at math. I did all that. So the electrical, the down and back part of the loop is about 30 to 35 milliseconds, meaning a nerve signal to your muscles and in your hand all the way back to your brain very quick, very quick. So also now to get the muscles to actually release acetylcholine, to actually trigger the muscle to contract, to now move your arm, that is a little bit longer, 100 to 200 milliseconds. So there's like 2 parts of it there. Now, here's for reference. Usain Bolt, 9.58 seconds, 100 meter dash. If you laid all your nerves in 100 meters, okay, 100 meter length of nerves, how much faster do you think it would be than Usain Bolt? Probably trying to do some math real quick. Anybody have a guess? How many seconds do you think it would take for the nerve to finish the race? If he was 9.58.
6 seconds.
Oh, 6. Got any other guesses?
3 or 2.
4 or 2. Any guesses? 5 seconds. Okay. So we're taking the fastest man in the world versus just all of us, right? We're gonna beat him. I think we're gonna beat him. Oh, now I got some new ones. Look at this. So your nerve signals travel about 5 to 7 times faster on average. If you stretch them out 100 meters long, 1.5 seconds, done. Okay, just like that. That's how fast. Just for you to do that real quick, everybody did that. There's a lot of complex processes that went on to make that happen. You didn't even think about it, but look how fast it travels. All this to say, the nerves are very fast and your body is very smart. How can it figure out how to do that quick? Like, it's a very smart computer, smarter than any computer in the world. So what we always say is we don't want to underestimate your body's ability to heal and perform, okay? We expect miracles here. Everywhere else in the world, they're going to tell you, you got to take out this organ, you got to do this, you got to take this supplement, do this. We understand the body is very powerful and it's very smart and it functions at such a high speed. Don't underestimate it. It still is faster than the fastest man in the world. So that's pretty good. Give yourself a pat on the back. You're quicker than Usain Bolt. Let's go. In a way. So that is the end of it. Any questions, comments, concerns?
I want to see this race between the nerves and
It's a signal.
It's a signal.
All right.
It's kind of sick.
Any other? Yes.
You did the 100 meter in college, right?
Oh yeah.
Just curious what your best time in comparison to the fastest man in the world.
You know,
Yeah, 25 minutes.
it depends on if you're like a track person or not. So you might think, oh, that's not too slow compared to him. So I hope you think that, but it was 11.18, 11.18. Almost got into the 10s. The 10s is like pretty good, but I wasn't really like a sprinter. I was a jumper. So for a jumper, I was kind of slow, fast. So 11.18.
Faster than everybody in this room.
So,
Yeah, that's
but
right.
Well, thanks for coming, guys.
Yes.
And then make sure you get some more snacks on your way out too as well, okay?
yeah.
Yeah.
Very good.
Yep.
Yeah.